Okay.
Do you want me to give them?
No,
Oh, no, I can. I'm happy to. Deep voice.
Please take your conversations outside. Thank you. Panel will start here in 2 minutes.
You want me to get these?
Ladies and gentlemen, please wind down your conversations. We are about to begin the next panel. So yes, if you are talking or someone that you're listening to is talking, please hear the sound of my voice. If you can hear my voice, clap once. If you can hear my voice, clap twice. If you can hear my voice, clap 3 times. If you can hear my voice, clap 4 times. Okay, so we are just asking that anyone who's speaking now, if your mouth is moving, sound is coming out of it, that you allow the panel to begin. Find your seats, settle in. Here we go. Gentlemen in the back.
You guys take your conversations over there, just because it's really loud over here.
All right, we're going to go with that. Over to you, Heather. Thanks.
Hello everyone. For anyone who wasn't here this morning, I just want to introduce myself. I'm Heather Kelly. I'm the Executive Director of the Real Mental Health Foundation. And I'm introducing this session for a very special reason. Before we begin, I want to take a quick moment to say how proud and honored we are to have the Carter Center present here with us in Davos for our Mental and Brain Health Day. In light of President Jimmy Carter's recent passing just a couple of weeks ago, we want to take a moment to honor his remarkable life and enduring legacy. The Carter Center was founded by President Carter in 1982, and his wife Rosalind founded the Carter's Mental Health Program, the Center for Mental Health, 40 years ago. And in this session, Samhita Kumar is going to be talking about their global work. Through the Carter Center programs, President Carter dedicated his life to advancing human rights, eradicating diseases, and fostering democratic ideals across the globe. It's a testament to his belief that each individual has the power to make a difference, and that hope, no matter how fragile, is always worth fighting for. I invite you to keep this in mind in the context of everything we're learning today about human brain and mental health. And with that said, I invite everyone here to observe 5 seconds of silence in honor of President Carter's life, legacy, and commitment to global peace and democracy. Thank you. A lot of silence now. And thank you. And now I invite Jennifer Wu-Schwab, who we're so delighted to have with us, to lead us into the next panel, which we want to dedicate to President Carter.
Thank you, Heather. Hello, everyone. Welcome to this last panel of the day on global wisdom, transformative mental health innovations from the Global South and the indigenous cultures. My name is Jennifer Wu-Schwab. I am an entrepreneur and host of the Founder Spirit podcast, and it's absolutely a pleasure to be with all of you and with my panelists. And before we introduce our panelists, I like to just take a moment and to, in line with some of the traditions of our panelists, to acknowledge the land which we're gathered today and gently ask for permission to open our hearts and our minds to whatever we're about to receive, and also honor the local stewardess of the lands, the Davoser people, for taking care of this beautiful place for generations so that we may gather here year after year to learn from each other, to connect, and to reflect on improving the state of the world. So without much further ado, I invite my panelists to introduce themselves and their organizations, and also in a few words at the end, tell us what mental health means to them personally. Samhita, Kumar, I'll start with you.
Thank you. Is this on? Can you hear me? Great. Hi, everybody. I'm Samhita Kumar. I'm the Senior Associate Director for the Mental Health Program at the Carter Center, based in Atlanta, Georgia. We have a mental health program that covers quite a number of things, but public policy, mental health journalism, and health system strengthening are top among them. I really appreciate the reflection starting this session on President Carter. Thank you, Heather. We are very sad to have lost such distinguished spirits of our institution. Both President Carter and Mrs. Carter in the year past have so fiercely led our center and guided the principles around which we operate. President Carter believed his whole life that health was a human right, and for Mrs. Carter, that there was no health without mental health. And so that was really what laid the foundation for the mental health program to start in the 1980s. And since then, it's just taken off to be able to address what remains a top priority in global health and development. So for me, part of the meaning of mental health is really in their legacy, identifying that there are issues like mental health that we have just neglected and that they need to be addressed by someone. So that's very much in her trailblazing leadership, something that I find inspiration in and have taken on.
Mindahi.
My name is Mindahi Bastida from the Otomi-Toltec peoples from central Mexico. I'm the founder and convener of the Earth Elders. And I'm very honored to be here in this time and space. And thank you for honoring the entities, the deities, the spirit of this land. From the Mesoamerican perspective, the ancestral civilizations that we represent, the Otomi-Toltec and the Olmec and the Mayans, we see the world that is interconnected. So the mind is an energy. And when we talk about mental health, there should be a harmony, in harmony. When you have harmony between the matter and the spirit, then you can find mental health. And also, when you produce beautiful thinking, clean ideas, if you don't produce those, you are in trouble. So mental health is a projection of the thoughts in the matter and in the spiritual world.
Anna.
Hello, everyone. My name is Anastasiya Kulygin, and I'm a founder of AguilaCondor Foundation. The foundation was formed as inspiration by a Native American prophecy, and the prophecy states that there will be a time when the life on the earth is dying, and at that point we will unite. We'll unite the eagle and the condor, which represent the modern world and the indigenous world, the microcosm, macrocosm, the yin and yang. So it all is going to unite in order to protect the life on the planet Earth. And what mental health means to me, first of all, when I think about mental health, I don't think only about mental and I don't think only about health, because in our modern view, we kind of have this approach to, divide and conquer. There are doctors that specialize only on the knee, only on the brain, and look at the parts separately, right? But when I think about mental health, I think about the entirety of the body. I think about the entirety of our communities, our environment, the nature around us, and all of these relations. I'm representing here indigenous tribes, and it's a huge honor to be here and represent them and their voices. I represent Inga tribe, and I also represent Sandor Iron Rope, who is a full-blooded Lakota chief. How do you say? Chief. Here you go. Thank you. And it's a huge honor to represent them and represent their cultures and their traditions and their teachings. And in many indigenous traditions, for example, Mexican one, they say matukuyasin, which is in for all of our relations, meaning how do we relate to our body, how do we relate to our environment, how do we relate to our friends and family, everything, because everything is in relation. The microcosm is related to macrocosm. So mental health is a relation to everything around us. And then health is it's not only about getting healed. It's also about mental resiliency. It's about advancements and empowerment at the end of the end of it.
Thank you, Anna.
Thank you.
Samhita. So according to the World Health Organization, around 1 out of 8 people in the world, that's about 970 million people, live with a mental health disorder. And the most common being depression and anxiety. And as someone that's worked in mental health for a long time and also from many different angles, from research to clinic, psychology or psychiatry to policy and international development, I was wondering if you could help to contextualize the global mental crisis for us and also talk a little bit about the work that the Carter Center is doing.
Yeah, absolutely. I think I feel like I've had a unique vantage point being able to span these different functions and platforms in mental health. And one thing that really comes out strongly is how multidisciplinary a challenge and responsibility this issue really is. I think we can all agree in this room that mental health is for everyone and that it affects everyone. The COVID pandemic was the most obvious window into what this looks like, but you can see when we have poor mental health how widespread that toll ends up being and how it exacerbates life for people with existing conditions as well. And so really trying to look at this from beyond just the health sector, but education, finance, infrastructure, violence prevention, all those things that shape our social determinants and affect our well-being as a whole is very much what this challenge needs to be met head on. In the Liberia program, that's been our kind of flagship country program at the Carter Center for the last 15 years. And that holistic approach to well-being has really been embodied from the very start. We have tried to build this mental health ecosystem with government and partners where the goal is that you can access mental health care through as many entry points in communities as possible. That means that awareness, sensitization, and resources to support are available through schools, through clinics, through the police, through journalists, through community leaders. And that kind of training and that view that communities are what supports mental health is really kind of the foundation of what we've done in the mental health program, both in low and middle income countries, but also in the US. And I think there's a lot to be learned there in terms of transferability and applicability from the Global South to other places about how do we approach mental health work and community building and systems building, and who needs to be part of that conversation. So the Liberia approach has really taken that as the foundation, and it's looked specifically at workforce as a big area, both health and non-health related, at policies and financing to make sure that we have the mandate to be able to do mental health service delivery, and then of course at advocacy platforms, because it is ultimately those stories that enable change and enable people to hope for something better in their lives and move forward.
Thank you. Thank you, Samhita. Mindahi, Indigenous people only make up 5% of the global population, yet they take care of over 80% of the biodiversity on Earth. As an advocate of Indigenous rights on the world stage now for well over 3 decades, I was wondering if you could share with us some of the ancestral wisdom with the audience in general, and also as specifically related to mental health.
Yes, and the so-called indigenous, the word indigenous is that you are from origins, from a territory. So we all are indigenous to the land, first of all. But original nations and peoples is a little bit different, because we have kept that sacred relationship with nature and with the cosmos. And that's the very reason we have been protecting not just the 80% of biodiversity in our territories, because we take care about Mother Earth as a body, as a being. So we call Mother Earth because nurtures us, because gives us all who we are. In our cosmovision, we say that the four sacred elements of life, the earth, the air, the fire, and the waters, are not resources. They are sacred elements. So we are here at the World Economic Forum, how we treat our mother, how we treat the waters. And they are medicine. They are really medicine. In public policies, they are treated like a way to get more money. It's very sad. And we are intelligent. How intelligent we are. How kind of creatures we are. 7,500 years ago, peoples in this world were a lot more than we are now. More than 7,500 we are now with different cultures. We have double. But we are losing possibilities. Every time a language is lost, we lose possibilities. We lose ancestral way of relating to the cosmos and to the natural world. So we say that they are our relatives, the mountains, the rivers, and we are the mountains, we are the rivers, we are the sea, we are the stars, we are the reflection of the sacred elements. But what is happening now? Commodification of life began to take over. Some people began to go away from the original instructions. Some people began to go from the natural law of the universe. And this anthropocentric way of thinking is killing us, is killing life. So we need to rethink our place in the world. Because even in some traditions who are in this dominion or domination way of being, it's so difficult because it's the way we learn at school, at the universities. Instead of collaboration, it's competition, to take over. And we say to take care, give care, not to take over. So 7,500 years ago is a lot of time. But it's not a lot in the millions of years of this mother. So maybe we are just a nightmare. Maybe. We have misbehaved so much with other beings, with other relatives, that we feel that we are the peak of the creation. Even some holy books say that we are the ones. But you see that. We need to rethink our place in the world. We need to rethink those ontologies that we are, how we are relating to the natural world and even to the spiritual world. Because, yes, the mindset that we have now has provoked this crisis, this systemic crisis. And climate change and all of that is just the symptoms of this sickness. But we are not just us. Mother Earth is sick as well. Father Sky is sick. What are we going to do? Well, we cannot go back to the past because we cannot live in the past. But we have to honor our ancestors, our lineages. We have to gather again in family. We need to go and come back around the fire and talk among each other. We need to really strengthen families and then communities and also territories. And that's the reason we don't call just culture and biodiversity over there. We don't see that division. That's why we want to bring this beautiful concept of biocultural heritage, biocultural diversity. In that sense, we know that some scientists have said that at least we have 5,000, 7,000, others say 13,000 thoughts during a day. But most of them are negative. Many are repetitive, and very few are positive. So we really come back. We have to come back. Remember that we are one in the concert of life. We are just another species, and we must behave and be more humble in this world. Kamadi, thank you.
Thank you. Thank you so much. Anna, your LinkedIn profile says you're very passionate about elevating personal and collective consciousness. And I would love to have you share your own personal journey with the audience, from the world of high finance to founding the AguilaCondor Foundation, because when I heard it, it really touched my heart. So please.
Yeah, absolutely. So I have a background, corporate background. I used to work for hedge funds and investment management firms in America, and all of that it entails. It means no work-life balance, careerism as a culture. It means that normalize anxiety and depressive states and coping mechanisms that are not healthy. It means living for a weekend and holidays. So eventually I burned out. And I hired a very expensive therapist, and she was helping me to kind of stay afloat without use of medications. And then I started looking for something that's, a solution that could be really provide better results to me. And a friend of mine recommended sitting in a ceremony with indigenous people. And that night, that ceremony divides my life onto before and after. It was groundbreaking. It was transformational. My physical health improved. My mental health improved. My relationships have improved. I'm sitting here now because of that encounter with indigenous traditions. And just learning this culture and learning from these people is the most heart-opening experience. It's the most transformative experience. How to live in harmony with nature and with yourself. It's absolutely beautiful. And so I'm extremely passionate about bringing this expanded state of understanding, this awareness that indigenous people provide to people like me. So AguilaCondor's mission is to amplify their wisdom, provide the platforms for them to speak. Next year, our prayer and the wish is to have an indigenous house here in Davos. And also, thank you. And also, the mission is to protect their medicines, because traditional people, original people, they're botanists. They heal with plants. So we're protecting their plant medicines and also protecting their lands. Especially in Amazonia, we have a project in Colombia that is basically the lungs of the earth. And it's the most biodiverse and dense land. And currently there are actually conversations about putting railroad right across the lungs of the earth. So we're trying to protect that with all the efforts that we're doing with raising awareness. There are industrial agricultural exploitations of these lands. So our mission is to protect these lands as well. And then on a personal level, I'm also founder and CEO of wellness retreat organization where we combine different modalities from functional medicine to psychedelics to technodelics to expand consciousness of the leaders, of the business leaders, to make an impact so that they can then expand their consciousness and make impact on their communities.
Thank you so much. We're going to now talk about different healing modalities, and I love to go back to Samhita, where she was talking about Liberia and taking Liberia as a case study where you basically work now for 15 years, and in a country that has very limited resources and no access to, mental health care, basically facilities, and I was wondering if you can tell us kind of what are the concrete lessons that you're taking from your experience in Liberia and in replicating that to other countries that have limited resources?
Yeah, absolutely. So I don't know how familiar all of you are with Liberia and its country landscape, but it's a population of about 4 million, maybe 5 now, and it is in West Africa. It has experienced a lot of different crises and shocks. Civil conflict in the early 2000s, late 1990s was one of the major ones, but you may be also familiar with the Ebola outbreak in 2014 and numerous other challenges that people throughout the country have faced. So we came into this setting from mental health program really following on the footsteps of our peace colleagues at the Carter Center who had been involved with conflict resolution program and eventually later on election observation. And in our partnership with the government, we had been talking about how much trauma the population had faced through this civil conflict. And the interest in mental health really came from them. What can we do to be able to support people through this experience, especially now that our health system has been decimated through the conflict? So that's really when our engagement began, is to see where across this landscape can we start building back better in a way that includes mental health and really puts that at the forefront of the government's agenda. So we started with the mental health law, which didn't exist before, and that was really the first piece of legislation to come into action in 2009, followed by a mental health policy and strategic plan for the country that really outlined what the priorities would be for that next 5-year term. And through that, we slowly started to chip away at these really important pieces of health service delivery. Do you have a workforce? When we started our work in Liberia, we had 1 psychiatrist. We had pretty much no facilities dedicated to mental health, dearth of psychotropic medication access, you name it, just a really fragmented system in which health service delivery already was suffering and that mental health within that was really neglected. Now we have, with partners, with the Ministry of Health, come so far in this landscape. A big part of our work has been around workforce development, which has looked at the training of physician's assistants, nurses, registered midwives, to shift this concept of task shifting, to shift care from psychiatrists, where we don't have many, to this middle tier of the health workforce. And many of these people are civil service servants already, and so they've taken the 6-month break to do an advanced practice clinical nursing certificate and then gone back into the workforce to do this work. Now we have over 360 mental health clinicians like this in Liberia across 15 counties, of which we have a subset of about 180 that are focused on child and adolescent mental health. So that coverage is enormous. I mean, of course, there's more to do, and there's a lot more that needs to be done to reduce that number of clinician to patient ratio. But just think about where that was and where that is now, and the commitments that have had to be made to be able to keep it going. So that's a big area. With training, you need sustainability. Where do these clinicians go down the line once they've been trained and they're entered back into the workforce? Task shifting, there's always this risk that you overburden providers by giving them a greater caseload just because they have interest in doing something good, and then they're burnt out and unmotivated to keep doing the work. So what we've really been trying to do is work with the government to make sure that they have the licensure and the accreditation and then the civil service reclassification to get the status that is a commensurate with their new qualifications, right? So they have a salary pathway moving forward. They have a career development pathway moving forward that enables them to do this work for what effort that they've put into it. And so that has been a big change, still ongoing, to make sure that it is the right reclassification and that they get paid what they need to get paid, but really transformative in thinking about a pipeline of providers that can then be dedicated to mental health. And then the last thing I think that I will mention is policy and advocacy. We really need a concerted effort around the policy frameworks and the advocacy platforms that are here at the country level and getting them out of the country and even at the global agenda. Liberia has done a phenomenal job with having both of those aspects to the programming. One, getting mental health into every policy, health policy, education policy, security policy, you name it. They're open to figuring out a way to create that space for people to act and work in mental health. Financing, they've recently done a mental health financing assessment in Liberia to really look across government. What does health financing for mental health look like? Where can we access resources and where can we rethink what we need to do? And I think that's a great tool for a room of partners like this to think about at the country level, how are we engaging and how are we trying to up the percentage of mental health in national budgets, because it's so low. It's less than 1% on average of the health sector, which is ridiculous. There's so much more that needs to be done. And then the advocacy is taking people, you need the voices of people with lived experience to inform what kind of system you want. At the end of the day, it's their system and they have to be able to use it in a way that meets their needs. But I think the big lesson learned is that it's not enough to look at this at a project level or a service line level. How do you get beyond that? We have found that the advocacy has been so transformative in thinking about who is listening and what they're talking about in the country that, when we got this user network in front of legislators in Liberia, they were able to get the government to commit to mental health dedicated funding within the Ministry of Health. After years of partners lobbying, we weren't able to do, but that was a powerful message that really came across well. And so looking ahead to this year, we have this focus on NCDs at the UN General Assembly and World Health Assembly. How do we get leadership at the country level to make it to the global agenda and advocate for these things and showcase what they've done and help move that conversation forward? I think that is that next part of transformative change that we have to focus on.
Thank you so much. And also just to mention that the Carter Center will be expanding into Uganda, Nigeria, and...
Yeah, I think what the remarkable thing about this experience is that other countries have really looked at this and seen what is possible to do when you really don't have that many resources to begin with. And so when they see this workforce, they see the policy change, they see the advocacy, they want to be able to do that too. So we've had interest from Sierra Leone, where we've started working, from Uganda, from Nigeria, to see how we can look at the mental health system with partners there in a way that fits their needs and try and continue to move a lot of this stuff forward while we still have the momentum.
Thanks. Mindahi, we had mentioned Anna had mentioned about plant medicine, and I know that it's gaining its popularity in the West, but there are also different modalities of healing from the indigenous culture. So you talked about words as medicine and Mother Earth as medicine. So can you please share a little bit more on that?
Yes, the plant medicine is very popular now in the Western world, but it's been always like that, because even the chamomile tea can give us some support. But I remember my grandmother, my grandfather. My grandmother was hit by the lightning. The lightning is, we call centella, not a thunderbolt, but just the lightning. And she received her powers through that light. And she could even heal just by saying some words with intention. And it's been very powerful. My grandfather taught me at least very basic connections with the universe. And one of those is when the sunrise is happening. at noon and at sunset. Just to bear in mind those beautiful moments. In between the day and the night, there is mystery. And when you connect with those moments, you connect with the essence of who we are. And that's medicine. We have many ways of attending these things. You know, the sweat lodge, the temazcal. We go into the temazcal. It's a sacred place. It's like a sauna kind of thing. Maybe you have experienced, some of you, the temazcal. But at least, because everything is interconnected, but there's people who needs more the material health. But also, we say that words are medicine because there you can share thoughts, you can share fears, you can discharge what you have, what is bothering you. But in the spiritual sense, also we call for the entities and the deities in ceremony. And it's so beautiful. That connection with the Spirit is the essence of who we are. It's how we can transcend. So yes, there are so many ways of really being in harmony, but I could say intention is the most powerful tool that we have as humans. We can see the change we want to see. And just if you can close your eyes, please, just for a second. Na yoho new. Heya! Heye haya 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 yo. Ush 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 ush. Ho 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 ho. Ho 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 ho. Ho 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 ho. Thank you.
Thank you, Mindahi. Thank you. Anna, as someone who bridges ancient wisdom and modern health solutions, what do you think the Global North can learn from all that you've heard today with Mindahi and also the work from the Carter Center?
So the word bridge is the right word to use here, because we are bridging and we are an indigenous-led organization, which is a really important point. We believe that, the modern world is incredible with all these technological advancements that we have. We, the modern people, we know how to build bridges, we know how to build roads, organizations, technologies. But in order for the real change to happen, to solve incredible problems like climate change and wars and so on, the leader has to be a spiritual leader. This is a spiritual work. So this bridge that has to happen, and we are, as our organization, we're listening to indigenous, to their spiritual wisdom, and then going and building those bridges because we know how. So what can be learned is I started learning about these cultures and the languages, which is incredibly beautiful. To give you some example, in, for example, Lakota language, they have 70% are verbs and 30% are nouns. In comparison to English language, it's the reverse. It's 70% nouns and 30% words. So the water or the creek is a being, the mountain is a being, the animal is a being, a tree is a being, and it's constantly evolving and moving. So when we shift our thought, and the shift has to happen in the level of a thought, because that's the only disconnection when we have. If there's if the tree is relying on me on my CO2 and I'm relying on a tree for its oxygen, the only separation that between me and that tree is the language. So, and the thought. So the shift has to happen there, right? That we have to have emotional and spiritual connection to our environment. And actually, I was at the Deepak Chopra's talk recently, and he said that we should get rid of the word environment altogether, because the air is our breath, the trees are our lungs, the water is our circulation, and the earth is our digestive system, right? So this microcosm and microcosm and macrocosm are interlinked. There is a relation. If our soil is depleted, we have to, there is just no way but for our microbiome to be depleted too, right? So this relation, the transformation has to happen on emotional and spiritual connection to our nature. And this is not a woo-woo for people anymore. We just have to wake up to this, that we are nature. We're not part of nature. We're not a separate species that came from nowhere. We are part of the Mother Earth. And when we start relating to everything around us in a way that is a living organism, we start making different decisions, right? So we start asking, why would I build this road across the lungs of the earth? Because I'm cutting my own lungs. Why would I pollute my rivers? Because I'm polluting my own blood, right? So that is the shift we're looking for.
Thank you. So beautiful. Thank you. Unfortunately, we're running out of time. So I'd like to invite the audience, if any of these messages that you heard has resonated with you, let's not let them remain in the confines of Davos. Help to spread the message to your friends, family, communities, and world at large. And I want to thank you for all being here, the audience and the panelists, for sharing their work and sharing their wisdom and the urgent calls for us to reconnect with this knowledge, this body of knowledge, to also remind us the power of the collective, and as well as the importance of balance and reciprocity and the interconnectedness of life. So may we all live in harmony with nature going forward. Thank you so much.